Welcome back. An NHS doctor fears his career in the UK could be over due to a visa issue preventing him from re-entering the country. Dr. Nemeka Chidimije was training to be a surgeon in Newcastle when his marriage broke down, causing his spousal visa to be terminated. He was told to go to Nigeria and reapply for a visa as a new entrant, but his application has now been rejected 4 times. Well, a Home Office spokesman has said the government fully recognises the contribution that international professionals make to the UK and to our health service. However, it is important that our immigration system works in the national interest, ensuring that employers look first to the UK resident labour market before recruiting from overseas. Well, the doctor in question, Dr. Nemeka Chidimije, joins us now from Maryland, along with Iain Campbell, Secretary-General of the Independent Health Professionals Association, who's in the Isle of Man. Many thanks indeed for joining us. Mr. Chidimije, just to you first, tell us how this has impacted your life. You've been living in the UK since 2013 and working as a medic in the NHS since 2014.
Yeah, that's correct. I've lived in the UK since 2013. I've enjoyed working in the NHS. It's been a privilege to work in the NHS as a surgical trainee, most recently employed by Health Education North Eastern Cumbria. But given the change in my circumstances and how difficult it's been to get back into the country to continue the work I do, I find it quite frustrating and disappointing with the system.
And obviously, Mr. Campbell, the system working in this way means that we're losing qualified and trained NHS professionals. Your reaction to this?
It's utterly shocking. It's an outrageous example of a tick box mentality. And the NHS is drastically short-staffed. For them to try and claim that somehow this is acting in the national interest is frankly outrageous. We desperately need as many staff as we can get, and even if we approved every visa application, we would still be desperately short-staffed. Obviously, there's a very human consequence to this, and my heart goes out to Dr. Chidimije for this. But additionally, we've got to think on a societal level. I mean, obviously, we've put considerable investment into the training of trainee doctors like him, and to then land him in this situation doesn't help him. I feel very much for him. It also doesn't help the country as a whole, because we spend a fortune on this, and now, I mean, he already has a job here, and yet we are sending him away, claiming that we need to try and recruit people at home in the first instance. We wouldn't have the kind of reliance we have on temporary staffing were it not for the fact that we cannot meet our needs from sort of home-trained doctors. And immigrants, far from being a problem to our healthcare service, they are the backbone. They fundamentally, the service would not work without their help. And I wish to sort of thank them all for their contribution.
Now, Dr. Chidimije,
the other side of things, probably...
sorry to cut you short there. I'm just going to bring in Dr. Chidimije. You've had your visa application knocked back 4 times now, despite having previously worked in the UK in the NHS for several years. Your application meets the criteria in terms of salary and employment. What reasons are you being given for having your visa knocked back?
The reasons the reasons I have received from my employers who have been applying for a certificate of sponsorship have simply been that the caps have been reached every time. And this has meant that the Home Office decides the minimum points every month based on salary and the work that the individual is coming to do in the UK. This has varied from month to month since February to May. And so this has meant that I'm not able to come back and continue the work I do.
And Mr. Campbell, in response to that, the Home Office is saying that the caps have been met, therefore they can't sign off another visa. What do you make of that?
It is madness that does not take into account the needs of the system. We desperately need as many people as we can get. There is no way the NHS is not struggling without him. In fact, I can guarantee there will be problems and rota gaps and dangerous situations emerging. They probably are having to rely on very expensive temporary cover. This will have cost the taxpayer an awful lot of money, in addition to, obviously, the human fallout from it. This is not obviously the only problem they have. There are other contributing factors. They are obviously underfunding the service. but it certainly isn't helping. And I'm very grateful to the Doctors Association UK for the excellent work they've done on this Scrap the Cap the PR drive to try and raise awareness of this issue. Because it is.
Let me just raise this.
But it's also hurting.
Let me just raise this point, Mr. Campbell. The Home Office has said it's important the immigration system works in the national interest. Would you say this is in the national interest?
Yeah. I would say this is the polar opposite of the national interest. The national interest is in favour of having patients with a doctor to see them, and at the moment, this is the opposite of what they're doing. Unfortunately, this is probably not the only such case, I'm afraid. It's just the one that we're hearing about, and obviously they need to take a holistic view of this. They can't take a tick box mentality. I suppose it further blackens the name of the government following the Windrush scandal. They've consistently had very poor treatment of migrant workers. Indeed, we see in the NHS, even on the temporary worker side, a sort of two-tier workforce emerging, whereby temporary workers are being taxed both as an employer and employee, unlawfully, I might add, when they're sort of denied onto the NHS payroll because the NHS doesn't want to foot its employers' NICs. There are a lot of such issues going on in the background here, and the one common thread is this government really needs to improve its treatment of the migrant workforce.
Dr. Chidamije, you're in the US at the moment visiting family. You've worked in the NHS for 4 years as a doctor. Is there a danger that we could lose you to the US?
I don't think so. I am very keen to come back to the UK and continue the job I love. I work with brilliant trainers, colleagues, nurses, doctors, healthcare workers, and it's been such a privilege to work in the NHS for as long as I've worked in the NHS. I have got brilliant colleagues from the Doctors Association UK going with the Scrap the Cap campaign. They've been very brilliant, and I intend to come back to the UK and continue my work as a surgical trainee in the NHS.
Dr. Chidamije, we wish you all the best. Please keep us posted on your visa application. Thank you both very much indeed for joining us.
Very much for having me.
Time now for a check on the weather.